All right, so today I'm going to go ahead and discuss with you the muscles of the lower leg. And it's best to kind of separate the muscles of the lower leg in compartments. So we have the anterior compartment, which is composed of the tibialis anterior, extensor hallucis longus, and the extensor digitorum longus. This is the anterior compartment. The lateral compartment is composed of the peroneal muscles, or in other words, the fibularis muscles. And it's composed of the fibularis longus and the fibularis brevis. And then the posterior compartment is composed of the gastrocnemius, as well as, if we hide this, the soleus and the plantaris muscle. Okay. Now, if you retract this right here, this muscle, which is the soleus, we have the deep posterior muscles, which is the tibialis posterior, flexor hallucis longus, and the flexor digitorum longus. So we're just going to go through each one, and we're going to discuss the origin, the insertion, its action, and possibly each nerve distribution. Start with the anterior compartment. So we have the tibialis anterior, and the tibialis anterior originates from the lateral condyle of the tibia, and it inserts into the medial cuneiform. Let me just go ahead and hide this real quick. The medial cuneiform is a bone in the foot where the tibialis anterior connects to, and it also connects to the base of the first metatarsal. So the function of the tibialis anterior, I'm sure you guys seen this in multiple gym guru videos, but it basically dorsiflexes the foot. So the foot is nice and flat, it's nice and even. It dorsiflexes, so it takes the toes up to your nose. It's like the opposite of like pressing on the gas pedal. And it also inverts the foot. The nerve distribution, it's not seen here, but I can go ahead and include it. It is the deep peroneal nerve. Deep peroneal nerve, which is also from the spinal cord L4, L5, and S1. Let's take away the tibialis anterior for a sec, and now we have the extensor hallucis longus. As you can see, the extensor hallucis longus connects to the big toe. Hallucis means the big toe, pretty much. Originates from the anterior surface of the fibula and the interosseous membrane, and it inserts into the distal phalanx of the first toe. And its action also is to dorsiflex the foot. It extends the first toe. So your toe is like this, it extends it up, and it inverts the foot. Okay. Next, we have the extensor digitorum longus. This one originates from the lateral condyle of the tibia, and it inserts into the middle and distal phalanges of toes 2 to 5. So, extensor digitorum longus originates from the lateral tibia and inserts into the toes except for the big toe. Its action is to extend the second through fifth toes. It dorsiflexes the foot, but this one everts the foot. So this is the only muscle in the anterior compartment that everts the foot. The extensor hallucis longus and the tibialis anterior invert the foot. This muscle everts the foot. And this is also innervated by the deep peroneal nerve and spinal nerve roots L4, L5, and S1. All right, so that's the anterior compartment. let's take a look at the lateral compartment. So here we have the peroneus longus. So the peroneus longus is a fascinating muscle because it connects from the lateral head of the fibula and it comes down to the foot, but it wraps around the foot underneath and it comes to the base of the first metatarsal. So let me go ahead and show you exactly what I mean. I'm just gonna hide everything else and boom, hide the plantar fascia. So here we go, fibularis longus. As you can see, it connects from the lateral fibula, right? It comes down to the foot and it wraps around and goes to the first, or it goes to the base of the first metatarsal. It everts the foot because it's coming from the side of the foot. And I just think that's very fascinating because you don't really think of a muscle coming down and wrapping around. I don't know. Okay. So the action of this muscle is to evert the foot and assist with plantar flexion. And now we have the peroneal brevis, which is, if we just take this away, it's basically its little sister or its little brother of the peroneus longus. The peroneus brevis is the little sister of the peroneus longus, and it's basically from the distal lateral fibula, and it inserts to the tib tuberosity of the fifth metatarsal. It has the same action. It everts the foot and assists with plantar flexion. So those are the lateral muscles. Now let's take a look at the big dogs, which are the gastrocnemius, including the Achilles tendon or the calcaneal tendon in this case, and the gastrocnemius basically originates from the condyles of the femur, so it crosses the knee joint, and this is a very important thing to remember because the gastrocnemius assist with knee flexion. Okay, the gastrocnemius flexes the knee as well as plantar flexes the foot, so it works on two joints. When the knee joint is flexed, meaning it's bent, the gastrocnemius is on slack. The gastrocnemius is not activated when the knees are bent. In other words, it's not working. But the soleus takes over because it doesn't cross the knee joint. The soleus originates from the proximal posterior surface of the tibia, and it inserts into the calcaneal tendon that basically inserts at the calcaneus. And the soleus does not cross the knee joint. The triceps surae, or in other words, the soleus, is the main muscle activated when the knees are bent. Keep that in mind. It's very important. And then we have the plantaris muscle. The plantaris muscle is essentially a weak plantar flexion and a weak flexion of the knee. It also crosses the knee joint, so it originates from the lateral condyle of the femur and it inserts into the calcaneus. And then we have the popliteus muscle. Medially rotates the flexed knee and it helps flex the knee. It's originating from the lateral condyle of the femur and it inserts on the proximal posterior aspect of the tibia. And all the posterior compartment muscles are innervated by the tibial nerve, by the way. So two very important muscles to remember: the popliteus muscle, which helps with the screw-home mechanism during terminal extension, and the gastrocnemius, is only activated when the knees are straight, and it is on slack when the knees are bent. Okay, so those are the superficial posterior muscles. Take that away. Now we're into the deep muscles. So now we have the tibialis posterior, which originates from the posterior shaft of the tibia, and it inserts on all 5 of the tarsal bones and the bases of 2nd to 4th metatarsals. Okay, its action is to invert the foot and plantar flex the foot. Now, if you take that away, we have the flexor digitorum longus and the flexor digitorum hallucis. So the flexor digitorum longus basically just flexes the toes down into the floor. So flexes the toes down like a claw, and originates from the middle half of the posterior fibula. As you can see, flexor digitorum longus, and it inserts onto the 2nd to 5th toe. And now the flexor hallucis longus. Remember, hallucis means big toe. So it originates from the middle half of the posterior fibula, and it inserts into the distal phalanx of the first toe. This muscle flexes the first toe. It's a weak plantar flexion, and it inverts the foot. All right. So as you can see, those are all of the muscles of the lower leg compartment. If we go back to our image, here we go. So we talked about the anterior compartment, which is innervated mostly by the deep peroneal nerve, L4, L5, S1. And the main action of those anterior compartment muscles are to dorsiflex the foot. The tibialis anterior and the extensor hallucis muscle invert the foot. Meanwhile, the extensor digitorum muscle everts the foot. And then we talked about the peroneus muscle, which is the lateral muscles, and the muscle that wraps around the foot. We talked about the peroneus longus and the peroneus brevis. So it's like big brother, big sister, little sister, whatever you want to refer it to. And they mostly act to evert the foot, and it assists with plantar flexion. And these are innervated by the superficial peroneal nerve muscle, the superficial peroneal nerve supply, L4, L5, S1. And then we talked about the superficial posterior muscles. So we talked about the gastrocnemius and its importance with knee flexion, because it crosses 2 joints and it's on slack when the knee is flexed. And the soleus being the type 1 muscle fiber, and it's activated when the knees are bent, but it's also activated when the knees are not bent. And then we talked about the plantaris, which is now shown here. And last but not least, we talked about the deep posterior muscles, which is the flexor digitorum longus and the tibialis posterior muscle and the flexor hallucis longus. Those posterior compartment muscles are mainly acting to plantar flex the ankle. So it's basically like you're putting your foot on the gas pedal. And it also assists with other actions such as flexion of the knee, especially for the gastrocnemius and the popliteus, as well as invert the foot during, it also activates to invert the foot. Specifically, the deep posterior muscles assist in inverting the foot and plantar flexion. And again, these posterior muscles are all innervated by the tibial nerve L4, L5, S1. All right. If you like this video, please give it a thumbs up and subscribe and share it. I'm sure you're probably cramming for the exam right now, which I don't blame you because I did almost the same thing. But hopefully visualizing the muscles and seeing where they are on the human body kind of helps you remember a little bit more. But yeah, give this video a thumbs up, share with a friend, subscribe, and good luck on your exam. If you're not taking an exam, thanks for sticking around, and see you guys on the next one.